Welcome, ladies and gentlemen, to another edition of Health Reform 2.0. Today is one of our HealthyBytes series. And in this series, we're going to talk about price transparency or the lack thereof in healthcare. Now remember, HealthyBytes are quick points for fast learners. We keep these short, we keep them quick, and we give you an idea of what's going on. So with no further ado, let me turn this over to Tim Henning, my co-host.
Thanks, Tom. Anxious to talk about this topic. Price transparency has been a throwaway line in healthcare for many, many years, with nothing but words to make the public believe we have it, or we are getting there, where the truth is that we will never know what it costs before the delivery of the product and the service, and that's the way it was intended. So, Tom, you have a very nice Porsche, and one day the engine sounds a little funny. You are concerned. So you take it to the local dealer and say to them, hey, this Porsche sounds a little funny. Can you please take it, diagnose it, fix whatever is wrong, and if that does not fix the problem, do it all over again until the problem is fixed, can't be fixed, or there was never a problem in the first place. And then send me the bill after that. Oh, and by the way, if you break something along the way, I will pay for that as well. I am sure that will never happen, but it happens every day in our healthcare quagmire.
And you know what? It's happening to me right now as a result of the heart attack I had. I'm going through the same thing with some things that didn't go right for a variety of reasons. I'm on my coming up on my third hospital stay when I go to get surgery to repair this pseudoaneurysm of the femoral artery. And I was in the hospital last weekend for tests and treatment for another problem that's been all derived from the treatments that I had for the heart attack. From the patient side to the doctor or the hospital, no one really knows what they're going to get paid for the services that are rendered. Patients get services and they don't know whether or not the people that are providing the services are often in their network. Hospitals bill for services that are derived from the errors and mistakes, as you just discussed. Doctors simply never know how much they're going to get reimbursed for the services they're providing to you and I. And as a result of that, what we really need is to have value-based quality of life services, the thing we want, and life care services, the things we need. Today, these two things are commingled, and we treat them as equals, and we are expecting one political-based system to differentiate between them, and it just won't work.
No, it won't. So why does this happen? Well, part of it's because seeking healthcare is the biggest trust equation in the world. In my terminology, the trust equation is trust equals credibility plus empathy divided by risk. And you can see here a very unique equation that I think resonates with me and everyone else. The credibility of your physician and those people that are providing your healthcare. Hopefully they provide a level of empathy. Sometimes they do, sometimes they don't. And of course, the risk is very high. The medical marketplace is in the business of selling dreams. We see that every day on television ads. We witness that quite a bit. And it's a transaction based on trust. The standard, terminology that buyer beware doesn't apply in this case. The patient needs to believe, not only that his doctor possesses superior information, but that his doctor is committed to putting the patient's interest ahead of his own. As a consumer, we are in a uniquely vulnerable position. We cannot sample the product beforehand. There is a real possibility that that product will do more harm than good, and yet, even if it proves useless, we are expected to pay for it. I'm taking this from Money Driven Medicine by Maggie Marr. Maggie, I hope you're listening to this because your book is excellent. It's available on Amazon.com. Tom, you and I know what drives this model, but can you please dive into what the root causes are behind this type of situation and the cures?
Well, you've got a series of things, and since this is a short podcast, I'm just going to bullet point. One of the things is the confidential contractual arrangements between the multiple payers that exist out in the system. They have all their little contracts with doctors that limit what doctors can do. It is contractual, and it does put a doctor in a box many times about the kind of things they're going to do, particularly when it comes to pre-authorization of goods and services. Many times now today, doctors have to get those pre-auths, and if they don't get it and they do the service, the likelihood is they won't get paid unless the patient's going to pay for it. We have a predatory and hostile healthcare economic environment. It's for doctors to make money, they have to leverage hospitals, and hospitals have to leverage insurers, and insurers have to leverage doctors and hospitals. And then you have pharmacists and all these other people out there vying for the same economic dollar, and there is no supply chain relationship. It really becomes doctor versus doctor, doctor versus hospital, and doctor versus payer from the doctor side of the equation. There's a complete lack of accountability and oversight across the entire system. The system is designed to be able to provide benefits to the players and providers in the system. It isn't really there as much as we talk about it for the patient. Uninformed patients are a big problem, not only for the doctor, but they are for themselves, because if you're not informed, you're not an educated consumer, you're going to get clipped in this system. I can't figure out, and I think of myself as a highly educated consumer in healthcare. When I was going through my heart procedure, if I didn't know the stuff that I know, I wouldn't have been able to make any decent decisions going along, and at many points could have made decisions that were going to turn out fairly badly. There's a need for a facilitator to help a patient do this. Sometimes facilitators are nurses, and some insurance companies provide nurses to deal with you on their behalf and help facilitate your care to make sure you understand and follow, because it costs them money. But as I said earlier, doctors can't predict their reimbursement at any point, and as a result of that, they can't plan a practice. And at the end of the year, they can find out they not only didn't make any money, they lost money. And some of the doctors that have been suffering that for the last number of years are now out of business or retiring or going away. We're losing the resources that we need in the healthcare system today to take care of patients. It's an untenable situation. It's been this way for years, and it's now getting worse.
It is getting worse. Yesterday I was at the lab, and the elderly gentleman in front of me was trying to get help about the test he was having done and what was being reimbursed and wasn't. The poor guy was lost, and the poor person at the front desk wasn't willing to do anything to help educate the guy. So I stood up and helped him out, because he was completely lost of understanding what they were covering, what they weren't covering, and the person behind the desk wasn't helping whatsoever.
And because they don't know.
No, they don't know, and they push it back on the doctor. The doctor you know how that goes. It's go talk to your doctor. It's the same vicious circle.
And Tom, hold on. One other point about the doctor. He doesn't know either. He didn't take any classes in medical school to explain how he's supposed to navigate this quagmire.
Well, I think that's why you see more private physicians joining the foundations and becoming employees.
Right.
The only problem when you become an employee of anything, you can be fired.
Right.
So,
and we know a few that have been.
Many times, yeah. Absolutely. So how does our solution solve this mess?
Well, Tim, as you know, we provide a central point of administration for all healthcare services. We provide in our system for life care services that are delivered through one market, and quality of life services, the things you want, are delivered through another market. Our system comes together and brings both of those markets into one fully integrated center point of administration, so both sides are not only fully integrated, but there is full coordination of care and benefits across all sources. Patients, physicians, facilitators, insurers all know what everybody that is being treated is eligible for, so that they can coordinate the payments of benefits and reduce duplicated services and duplicated payments. The system we're proposing should be able to lower duplicated services, fraud, and abuse, and save us at least 1/3 of the healthcare spend, and free resources at the same rate, about 1/3 of the resources, because these individuals won't be completing the same task that someone completed 24 to 48 hours before. So it will do all that and provide a better outcome, and that's kind of what the general idea of the system we've created is.
Exactly. So thanks, everyone. Just a takeaway. You go seek healthcare, you're not going to know what it's going to cost you until after it's done. So that's just the way it is. So hope that was helpful. And Tom, thank you very much, and look forward to our next one. We will be doing a long episode on the predatory and hostile medical economic environments. Stay tuned for that, ladies and gentlemen. That should be very interesting.